Hey guys! Today, I'm going to show you on how to write a nursing care plan. Let's start off with the definition of the nursing care plan. It is a formal process involving the proper identification of current needs as well as the recognition of future needs or threats. When writing the best nursing care plan, completion of the care plan includes a step-by-step approach. It also offers a means of collaboration to achieve healthcare results for nurses, their patients, and other healthcare providers. When writing the nursing care plan, always start off with the name of the patient. Take note that you only need to write the initials rather than his or her full name. This is to protect his or her identification. Next is the age, sex, civil status, religion, the date of admission, room number, chief complaint, and the attending physician. Now, proceed to the making of your nursing care plan. Now, in your problem, what you have to write first is the date of your initial encounter with the patient. This is for you to measure after how effective your interventions will be. The signs and symptoms that you notice can be written in two ways. We have the subjective data and the objective data. When you say subjective, it is the verbalization of the patient. Sumasakit po ang tiyan ko at madalas din po akong dumumi ngayon. While the objective data can be assessed using your own senses. Like in my sample, abdominal pain, bowel urgency, loose liquid stools more than 3 times in 24 hours, increased bowel sounds, and especially the vital signs of your patient. So now, you need to base on the symptoms that you have listed and decide for your nursing diagnosis. When writing the nursing diagnosis, you always need to base it on the NANDA for you to be familiarized in the making of your correct nursing diagnosis. In my sample, my nursing diagnosis is diarrhea, related to the cause of it, which is the increase of stress level. Since this is the part of the scientific basis, we have to write the basis. This is just a brief discussion on how the problem or the disease came to be. Don't forget to always write your references. In this part, your goal and objectives should always be attainable and realistic, and you also have to be specific as to the time frame. Like in my sample, after 8 hours span of nursing intervention, the patient will appear relaxed and the level of stress will reduce to a manageable level and will report reduction in loose liquid stools. When listing down nursing interventions, it should always be according to priority. Prioritize what would be the most beneficial intervention that can address the problem of the patient that you can do as a nurse. In my sample, first, observe and record stool frequency, characteristics, and amount. Second, encourage her to restart oral fluid intake gradually. Third, encourage her to express or clarify her needs and concerns. Fourth, promote a bed rest. Fifth, provide bedside comfort. And sixth, explain everything necessary regarding her condition. Proceed to the rationale. The rationale is the reason why you are doing that intervention. In my sample, I will be doing my first nursing intervention for it will help me to differentiate and assess the severity of her diarrhea, and so on and so forth. Okay, now the last part of a nursing care plan is the evaluation. This is actually to determine if your intervention have been effective. In my sample, since I started September 19, 2018 at exactly 3 p.m., after 8 hours, it'll be September 19, 2018, 11 p.m. And my evaluation is that after 8 hours of nursing intervention, the patient appeared relaxed and the level of stress reduced to a manageable level. And she was able to report reduction in loose liquid stools. That would be all, and I hope you learned something from this video. Thank you!